Good evening, sir. Good evening. My name is Indira Sukun from Inspiration FM. So I want to ask, have you been vaccinated COVID-19?
No, sir.
So why have you not been vaccinated?
Sir, I don't think it is necessary. Or if I may say it the other way around, I'm afraid.
COVID-19 vaccination, you take them.
Who go give me?
So you not take them?
I don't think I know one, sir. Even though I know one. They come and want to give me because they never want to bring me money. Look at color they eat.
Sir, have you taken the vaccine before?
I know if you take them. I don't even know anything about COVID-19 and they hear it. And the people they talk say if you go take this vaccine, your fever go do you, malaria go do you. So now make a fear. No if you go take the vaccine, my sister, I beg.
Have you taken your COVID-19 vaccine?
No, I haven't.
Why?
Nothing. I haven't just thought about it, I guess.
Okay, do you have intention of doing that later?
Yes, I do. My mom had actually been telling me to take it, but then I've not actually gone to do it, but then I will.
Please, have you taken the COVID-19 vaccine?
This COVID-19 vaccine that came with palliative. Me, I didn't see the palliative. How then will I take the vaccine with empty stomach?
So, have you taken the COVID-19 vaccine?
I did not.
Do you have intention of doing that?
Well, I can have the intention to do it because according to the radio or other people talking about it, I know the thing is real.
I am inspired by all the experiences that have to do with life and everything I go through. It could be something as simple as meeting someone. It could be going through a rough situation. It could be friendships, family, God, whatever it is. Those are the things that inspire me to write and to make music. So this is Banky W. That's my inspiration. What's yours?
A very warm welcome to Health Break. Okay, so obviously you know what we are talking about, COVID-19. And in the studio I have already seated the State Immunisation Officer, Dr IME UDOH. Thank you so much for coming on the program.
Thank you, ma.
Okay, so let's just listen to that. We went on the streets of Uyo and also went as far as Eket. You know, some parts of Eket as well, just to take this reactions from people to get to know if they are really aware of COVID-19 vaccine or possibly what is causing what you would agree with me, there is a vaccine hesitancy.
Yes, I agree with you. From the interviews you've just done, there's a lot of hesitancy out there about the COVID-19 vaccine, and we're trying to see how we can overcome them. And I want to appreciate you and your station for creating this awareness and giving us the opportunity to get back to people and talk to them about COVID-19.
Okay, very
and
quickly.
Possibly reassure them of the safety. Me that is talking now, I've taken my shot and I'm still alive and well. And you can be sure you're talking to a human being in front of you. So the vaccine is not changing anybody and it's not killing anybody.
So we'll get to talk more about that in the course of the program, looking through very key facts. Today, August 16, 2022, Nigeria has confirmed 262,664 COVID cases. So far in Akwa Ibom, 4,973 cases have been confirmed. So from August 13 to August 15, 2022, 144 new confirmed cases were recorded in Nigeria. So coming back to Akwa Ibom State, of the 144 new cases reported, 9 states, including Lagos, taking the lead. That's talking about August 16 statistics. In the last 2 days, August 13 to August 15, we had Lagos take the lead, followed by Abia State, and Akwa Ibom recorded 10 new cases. But then we look at August 11. Some days back, NCDC reported Akwa Ibom taking the lead as Lagos recorded over 100. That's about 101 new cases. Akwa Ibom recorded over 293 specifically new cases, taking the lead from Lagos. So we have something to be worried about, as much as people think that COVID has gone away, but it's still very much around.
Yeah, Ima, I must agree with you. These figures are actually understated. And recently there have been a lot of cases of illnesses. And when you hear the symptoms, they look like malaria, but basically they share almost the same symptoms. But there are other symptoms you see, and even the duration of the treatment and non-response to our traditional anti-malaria drugs. You begin to think that we are dealing with something else. And we know what that something else is. We have been warned that the new variant is on the shores of the country, and I'm sure this is what we are dealing with, and is responsible for this wave that we are experiencing right now. So basically, this is COVID-19, and a lot of people who have not tested. If all the people who are ill have tested, this figure will be times 5 of this.
So that's you saying this figure is underreported?
Underreported.
Possibly we are not counting the numbers.
Underreported. A lot of people are not going to the hospitals. A lot of people are not having been tested. And that is why that figure is what it is. It's actually supposed to be more than this.
So I'm just listening to what you've said at this point, and I'm beginning to think about the fact that the numbers are more than what we've just stated from the statistics given by NCDC, and the fact that people are very worried about the vaccine. You know, Unit 7 is 2021 reports indicated that different countries have different vaccine hesitancy factors. Yes. Different factors, you know. So with what you heard earlier from some persons on the street, which other have you heard from our location?
Well, the usual, nothing really has changed from what it used to be. The idea, people are believing that the vaccine is actually supposed to kill persons who receive them. It's supposed to also make them sterile, that not have children, and all that. Basically, those are the common ones that I've heard. Then also the other myth part of it that is also associated with the Antichrist, number of the beast and everything. So basically, these were the common myths and bad publicity surrounding the vaccine. So the ones I'm hearing now, for instance, COVID-19 and palliative, I'm just hearing that for the first time. I'm also hearing people talking about that they don't know where these COVID vaccines are taking place. I'm very, very surprised with that.
Okay, we're going to come to that because I just want to ask, do you think people are really informed? Like, we're getting enough information? We know on radio we've had those campaigns on just to get people aware. Beyond radio, what else?
But the truth is that we don't stop creating awareness for the vaccine and even the disease. Just last week we had an engagement meeting with faith-based organization in the state, talking about the Christian faith, the Muslim faith, and we were able to engage all the leadership of these two major religions in Akwa Ibom state. And it was not on COVID-19, but almost all the other primary healthcare services that have been rendered in the state.
I'm aware of that particular meeting because I know we had a representative, and then those from the Muslim faith saying that they were engaged their worshippers.
Yeah, beautiful. So we expect that platform can create the awareness for us. Apart from the 4 radio stations that are constantly giving out jingles and announcements on COVID-19 vaccines available all over the state. As we speak now, we have about 390 primary health centers and secondary health facilities that are rendering COVID-19 vaccine in the whole state. We also have about 98 mobile teams that move from place to place. They don't stay one place. Wherever they hear there's a population, there's a crowd here, they mobilize to that place and they go there. So altogether, 496. And we also have other partners still supporting. For instance, FHI 360 is giving us about 94 mobile teams. When you add that, you talk about 582 or so teams in the whole state giving COVID-19 vaccine alone. So the services are there.
Okay, so of this 496, facilities you're talking about, can you mention some of them?
Okay, let's go to the primary health center at Barracks Road, the primary health center opposite the Federal Secretariat. We have St. Luke's Hospital, Anua. We have some private hospitals also.
So even at the private hospitals, it's still free?
Yes, it's still free.
Okay.
Still free. Maybe the private hospitals would charge maybe 500 now, 1,000. But basically, people who go to private hospitals actually go there for some reasons. One of them is prompt service delivery and maybe one-on-one access with their health providers. So we try to tell them, okay, if you're going to put a price on it, please let it be reasonable. So we try and say, okay, maybe 500, 1,000 for service charge and all that, but it's free. That's for private. But the private is still optional. You mustn't go to private. you should, if there are other avenues that you can get access.
So just like you said, it's accessible in this public health facilities.
Public health facilities, teaching hospital. Okay, I did not mention that it's one of the sites that you can get the vaccine. We have scattered all around the state. Every LGA have site fixed posts as primary health centers, secondary health facilities as general hospitals, and also have mobile teams to move from place to place and be given the vaccine.
Okay, you can be part of the program this morning. It's Health Break on Inspiration 105.9 FM, talking about the vaccines, the COVID-19 vaccine. As much as you want to think that, COVID-19 is no longer here with us, it's for real. We are having cases. We are seeing, numbers rising. Akwa Ibom, as at August 11, did take the lead from Lagos that we get to see, and the statistics was quite frightening. So you need to be aware of what's happening around the vaccination and make that decision to go get yours. Okay, so I'll just go back to Dr IME UDOH, the State Immunization Officer, live in our studio. Still talking about this. You've mentioned one key way in which you're trying to tackle the hesitancy issue, the unwillingness of persons to go out there to get their vaccine. That's talking about engaging with the faith-based organizations to help as much as possible on the pulpit. But then what other ways are you trying to address this hesitancy?
Basically, we have a team of persons, we call them the mobilizers, who are moving from community to communities, working with partners like the WHO, Breakthrough Action in Nigeria. We're working with FHI, with Japaigo, RISE, and there's a lot of partners.
Go into communities.
They go into communities and try to engage the communities. We're working with traditional institutions, with the paramount rulers and other clan heads and village heads, seeing how we can engage them to also see how they can become champions for COVID-19 vaccination. It's always good to start with the people who are in charge. For instance, when the COVID-19 vaccine started, everybody in government took the vaccine. We wanted to show ownership, so everybody from top to bottom took the vaccine. For me, that is State Immunization Officer, I can't be selling what I don't believe in or not taking. So I took the vaccine and I made sure my entire family took the vaccine. And we started from there. And we're making sure that people get to see those who have taken this vaccine and are still alive. Because that was the primary concern of most persons. There was the timeline of dying and all that, and there were people who were actually waiting to see those who took, whether they would die.
Drop dead.
Yes, and after we stayed and did not drop dead, I think that's when people started receiving the vaccine. And I think we're not getting the momentum we want. We want to say, okay, we are done with COVID-19 vaccination. We're looking at to get herd immunity, which is 60% of the population being vaccinated. We are far from 60%. For the last data puts us between 7 and 10% of the population of Akwa Ibom being vaccinated for COVID-19. So we are a far cry from safety. And for now, it's like people are really not, because the strains we are able to cope with them, but we don't know what is coming.
We're talking about COVID vaccine, and how very important it is for you to get yours, and the fact that most of those myths, the misconceptions, those things that come with taking the vaccination in terms of all the fears that people have created isn't true. You get to hear more on the program. I'm still talking with Dr IME UDOH this morning. I just want to bring you to the point of possibly giving, you said 7%, that's still very low, but then, you want to give the numbers of persons who have got possibly given us the situation report, that's part of it, but then more about how many persons, for instance, in New York, and then moving to the local government areas, to the remote parts of the state. Do you have the actual
figure that I've taken? I will not be able to call that number now, but I can be working on that as we go on.
Okay. Also, the situation report on people walking to the facility right now to get, the shot or the jab. Is it still possible to get one, or it is the follow-up that is happening at this point?
No, all the vaccines, in fact, we don't look at the bottle and say this bottle is for second dose. No, the vaccine, when you come and you have not taken it before, then you take it as your first dose. If you come and you have taken it before, you now take it as your second dose. And if you have taken your second dose and it's up to 6 months for Astra and Moderna and Pfizer, then you take your booster dose. Then it's 2 months for Johnson & Johnson for a booster dose. So basically, it depends on your immunization history that determines what dose you'll be getting. So it's readily available. All you need to do is just walk into a health facility and say you've come for your COVID-19, and you'll be given free of charge, and you walk away.
And given a timeline of what
you're given your second duration, your appointment for your second shot, and even your booster shot when to come back for it.
Okay, so I also like to ask at this point, about the possibility of ensuring that possibly persons that are worried, like they have just expressed their concerns about the fears around taking this particular vaccine, and you've actually said you've taken. We visited one of the facilities here in New York, Metropolis, where the vaccination is happening, and we spoke to a number of persons who were on ground. They had come to actually get the jabs, and this is what they had to say. Just stay with us. The program continues.
Number one is COVID-19 is real. Just like the name indicated, this virus came in 2019, and we watch television, we see a lot of things. We see people died. We see the world all over. There was lockdown, and government was advising us that we should save ourselves by taking this COVID-19. I have taken the first one, the second one. They told me there's another third one, and I've come here more than 2 or 3 times. They said this was not Pfizer, it's not available. So I'm happy today they said that one is available now. So I came to take it. It's for our own health. It's for our own good. People all over are taking it. The world all over. Understand? So the disease is real. I didn't see any side effect. Rather, my immune system was boosted. My immune was boosted. I was happy that I took it. I will encourage them to come and take it, even though the effect of what we experienced in 2019 has died down. They should not relent in taking it. It's good. Prevention is better than cure. So it's better for them to take it and prevent themselves from getting infected. Because nowadays we still hear cases of people getting infected with the virus, which means the virus is still with us here. It's not far from us. So it's only God that is protecting us.
Inspiration FM.
Okay, why I took the vaccine to start with. Personally, I love my health. And then you don't have to wait for something to occur before you treat it. For example, you don't have to wait to contact polio before you take polio vaccine. From young, you just start taking it. So that's why I took it. Because medical practitioners that says we should take it, they know what they are doing. And then I'm a mother. I have young children. I don't want to be the reason why my children contact COVID. I'm a business person. I don't want to contact it or give it to my clients as well. So it's healthy, it's important. That's why I took it. And as regards side effects, I didn't have any side effects. Nothing at all. I haven't tried that key on arm because I saw it on a video. I tried it, nothing stuck to my body. I'm not even aware of this outbreak in Uyo, but since I've taken first, second, I'm supposed to take booster, but they didn't have it. But I was here on Friday and they told me to come today, so that's just it. For the health reason. If you've not taken it, take it. It doesn't cost anything. You won't pay anything. So if there's COVID, you lose nothing. If there's no COVID, you don't lose anything.
Inspiration Radio.
I took the vaccine because initially I noticed at first people were saying as if it was just a joke, there's no COVID, but then it's a preventive measure. As I said, prevention is better than cure. I don't have to wait to get COVID before I can start taking those measures. So that actually prompted me. Then I've had friends that I lost some friends due to the fact that they had that COVID, and it wasn't really funny. So with that alone, that prompted me to actually go for the vaccine. I've taken the first dose and the second dose, so it's only normal for me to take the booster so that at least I know that I'll be able to protect myself and also protect my friends too. Because if I have COVID, it always means that my friends will be able to contact it. So that's why prompted me to take the vaccine. this vaccine is free. There's something about Nigerians who usually don't like something that is free. But I'll urge everyone out there, if they need to take this thing very serious, it is real. They need to go for that vaccine. And with the recent outbreak in Akwa Ibom, it shows that people need to take it even more serious than before. They should come and take it. All the health centers should have it, so they should visit any nearest health center to them and take it.
Health break.
Okay, so that's a confirmation from one person, 2, 3. Okay, the last person said something very critical. He said all the health centers should have it. And you've just confirmed 496 centers across the state.
90 centers across the state.
300.
And I said a mobile team,
okay.
98 mobile teams
makes it
who move from place to place. So whenever they tell them, oh, we are ready for vaccine, can you come and give us vaccine? That team, one of the team comes to that center and gives a vaccine. So we call them mobile teams. That means they can go to anywhere in the state.
So it's beyond people going. You're also taking it to the people as well.
Yes, if we have crowds, we are taking it to people. And we also wait that people who don't want to wait for us to come to their communities can go to any of their health facilities close to them in their local government, and they will get it.
Okay, so what about persons that get to say, okay, I'm keeping to the guidelines. You know, I get to wear my face mask, I get to wash my hands, I get to, adhere to the safety guidelines. Do I necessarily need the vaccine still?
It's an additional
protection.
Coverage, additional protection, not just for you, but for your loved ones. I remember those days we were not vaccinated. If I was ill, I never let my parents come close to me. I mean, they were on the advanced age, so I knew coming close to me, I was putting them in danger.
Okay.
So I would see my mom come and look at me and say, you don't want me to come in and see you. I said, no, you cannot come in. But now it's not the case anymore because they are vaccinated. They have also been vaccinated.
And so just like
so
one of the persons
come close to me
said in that interview, she said she thinks about her children.
That is
thinks about
others. Basically,
partners.
most of the times we do things, it's not really about us, but about the people that we endanger because of our own the things we do. Interactions with them, going to church, going to the bank, going to supermarket, anywhere you go, if you're carrying the virus, you're just spreading it up and down. So, but the thing is that if you're vaccinated, the chances of virus thriving in you is very slim. Once it comes in, your antibodies bring them down. So you're actually a safety to the environment because
I'm still making reference to what I listened to as well right now, because one of them still said, after taking it, I could feel that my immune system had been boosted.
Yes.
That's the feeling.
Well, I don't know about the feeling.
That's what he said. He felt that way.
Yeah,
feeling reinforced.
Yeah, I'm sure he felt reinforced that he has done the right thing. He has taken a vaccine, and we have seen the success stories of vaccines. This is not the first time. The world is sleeping today from many of our vaccine-preventable diseases because of the availability of those vaccines. For instance, Nigeria just joined the other leagues of countries to celebrate a while polio-free. At 3, we're going to 4 years now, or 5, and that's because of the vaccine. What about measles and other things that would have been something that would have kept us on our knees? But because of vaccine, we are able to thrive and have a chance at survival. That's what the vaccine actually provides us. It gives us that added edge over not having had an alternative to life. And don't forget, most of our viruses don't have treatment. They don't have cure.
Okay.
So the best treatment still remains prevention. And what is the easiest, accessible, free, safest, effective prevention out there for COVID-19? It is a vaccine.
I believe that as people get more enlightened, get more information, get more sensitization, we're going to see that number, go up, from 7%. That's what you said.
Yeah, about 7%.
And then we're looking at over 60% herd immunity.
60% of the
60.
Yes, so for us to know that we have herd immunity for COVID-19.
Okay, we look forward to more of the good news coming, and I'm sure more people will embrace this, knowing that it's very much available in all the health centers.
About 200 and something thousand people have taken the vaccine in Akwa Ibom.
All right then. Thank you so much for coming, Dr IME UDOH, State Immunization Officer. Yes. And also to say congratulations, you just moved from being the NMA chairman. That was something to talk about, really. But then we just wanted to focus on this. That's what you came for.
That's what we came for.
All right, then. My name is Ima Dem. Health Break returns next week.
Inspiration FM.